degenerative disc disease, you are at the right place. And I'm so glad to have you here. And if you are with us live, please say hello. Would love to say hello to you. You let me know where you're from. We'll spend a few minutes. I'm going to answer some questions today that my mom's asked me continually. And so I thought we would do a live on a couple questions. And so I can give you what I would consider to be the best answers for you to help you feel better the fastest and as possible and quickly as possible. So welcome to Back Talks. It's a beautiful day here in Georgia. So let's talk about this. And for some reason, if I don't see your message and you send me one, I'm not ignoring you. Sometimes you have to refresh your page as well. As much as these electronics work good, they're not perfect all the time. So if you don't see me saying hi or commenting back to you, it's because I can't see you. So make sure you refresh your live, and that'll usually take care of it, and your message will come through. All right. So question number one: can I still care for my children as usual? That's a great question. If you have a bulging disc or a herniated disc, or you have degenerative disc disease, especially if you are experiencing pain, numbness, tingling going down your shoulders, arms, hands, or fingers, or buttocks, legs, and feet, my answer is no. You need to go talk to your significant other. You need to have a talk with your children, obviously, if they're old enough to understand you. Most of my moms have teenage children, somewhere between 35 and 55. It's the people that, I love to help. They will understand you, especially if you come from your heart. The disc has the least amount of blood supply of any tissue in the human body. It's the largest avascular organ in the human body. And if you don't take the time to rest and ask for permission to rest, not only from your family, but ask yourself and give yourself permission to rest, it can be a really long struggle. And don't think that surgery is going to be faster for you, because it's not, because you still have to rest after surgery, and sometimes even longer. So why go the surgical route if it's not absolutely necessary? Go a conservative, natural way of management, but you got to give yourself time to heal. I have a patient right now. This is her second time going through it. I'm so proud of her because she's asked her friends, can you help me? And they come over and they clean her kitchen for her. She gets rides to come get therapy, and she's getting better because we wrote a note for her work to get her off at 2-week periods so that she can take time to rest, because she knows as she goes back to work, she's going to be standing and sitting a lot versus being able to lie down. So we've written her notes, and it just takes those little things. So please, 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 moms, give yourself permission to rest and heal so that your body can heal strong and you can be the mom that you want to be. All right. So ask for help. Okay, trust me, it opens your family's hearts up when they know the mom needs help and they want to help you. As much as you don't think they do, they really do. All right, so don't be afraid to ask. Number two, is it safe to exercise or continue with my fitness routine? Well, that's a great question. I see that topic come up a lot on Facebook groups of people who are not certified in any sort of back therapies, giving recommendations to other people. All the things from you should be jogging, you should be doing squats and deadlifts to strengthen your spine. Listen, I've been doing spinal work for 26 years. I was voted one of the top spinal decompression doctors in the entire United States 3 years in a row. I know a lot. I read a lot. I've managed thousands of patients with this, and I'm going to tell you straight up, the answer is no. You need to rest and let your body heal. Okay? Plain and simple. If you continue to exercise, you will dramatically prolong not only how long it's going to take you to feel better, but the quality of how your back healed as well. So you have to rest. Just like we talked about in the first question. So stay out of the gym. I don't want you jogging or anything else like that. Okay? If you want to go for a little walk on a flat surface, slow, I'm okay with, but that's it. Until you get to the point where your symptoms are gone and your strength is coming back, your any sort of radiation down your arms, hands, or fingers, or buttocks, or legs is totally gone. And we know that your body, and it's usually about 8 weeks into doing like spinal decompression, we can start to incorporate some anti-gravity or gravity neutral core exercises to start to get some strengthening. But before that, I tell people, no exercise. Let your body heal and rest, because every time that you do, as your discs start to try to heal, if you're using spinal decompression to heal, you get these little microfibers that try to knit together, and then you get more of them and more of them, and eventually you're trying to heal that disc. Well, if you go out and start doing exercise, you tear those. And then you got to start all over again. And then, so it's this back and forth, back and forth. It's like sitting in a rocking chair, you know, you rock back and forth, you put energy into it, but you don't get anywhere. Well, it's the same thing with your back, and I don't want that happening to you for your back, okay? So super important. Please, please, please rest and stop your exercise program for right now. You'll be okay. And you know what? Sometimes God brings things into our life that we think exercise has to be the only way that we can manage stress. And sometimes, you know, we learn new ways. Get some new age books, learn how to meditate. Joe Dispenza has some amazing stuff. Thich Nhat Hanh has some great things. You know, there's a lot of people that can share messages with us to teach us. David Singer or Michael Singer about observing our emotions and how we feel. So it's a wonderful time to sometimes explore inner healing like that and realize that exercise doesn't always have to be the only vehicle that we use for stress management. All right. And the last thing is, are there effective ways, the last question that I want to go over with you today that my mom's asked me all the time is, are there effective ways to manage pain at home? Fabulous question, and the answer is yes. Of course there is. So what's my number one thing? Ice. Ice has amazing properties for reducing pain and reducing inflammation, two of the big things we want to do. How often do you need to ice when you're in a relatively acute stage and going through a healing process, especially if you have bulging or herniated disc? 6 to 8 times per day for 30 minutes. That's the answer. I know, don't shoot the messenger, but that's it. I have done all kind of combinations of icing. I've used a lot of different ice packs over my years. So I know a lot more probably than most people do about it, and I'm telling you 6 to 8 times. And I messed my back up twice, really bad. I mean, really bad, at a point where I couldn't even work. So I've been there, and as a dad too. So I want you to know I understand what you're going through, and I'm telling you the things that I use to get better and I use for my patients. So you want a big ice pack like this, and in fact you want 2 of them, not just 1. So don't be stingy, get yourself 2. And why is that? Well, the reason is because ice packs keep their peak cold on average for 15 minutes. And peak cold is what reduces inflammation. Ice keeps its peak cold almost the whole time until it melts enough that it really doesn't do that. But it's kind of cumbersome to put ice on your back and your neck. It just doesn't really stay in place very good, and it's kind of big and bulky. So an ice pack works great, but you want a big ice pack. And what I want you to do is I want you to ice for 15 minutes. Or if you get a good ice pack that'll keep its peak cold for 30 minutes, use it for 30 minutes, put it back in the freezer. And then in an hour and a half, I want you to take the other ice pack out of the freezer and ice with that one for 30 minutes. And then put that one back in the freezer. And then you'll have a cycle where you have enough time for the other ones to freeze so they're always at their peak cold, and that's how you can ice 6 to 8 times per day. 8 times is magical. I'm going to tell you that. If you try it, you're going to be like, wow, I had no idea. So that's one thing you can do. Second thing you can do is use a TENS unit. Okay, TENS unit is a little electrical unit. You put some pads above and below the area of pain, and you can turn it up to the intensity that you want. And the beautiful part about it is that you can wear it all day long, and you can sleep with a TENS unit on. Super important, okay? So I want to make sure that you know that. Don't be afraid to wear it for hours and hours and hours if it's giving you relief. Remember, it's not fixing you, it's for reducing pain only, but it can at least help you be more comfortable while you're going through a healing process. So that's a TENS unit, TENS, Trans-Electrical Nerve Stimulation is what that acronym stands for, in case you were wondering. What's the third thing that you can do? You can use over-the-counter medication, of course. What I see a lot of people do is either use Advil or Aleve, okay? Non-steroidal anti-inflammatories, or Tylenol or extra strength Tylenol. If you're okay taking either one of those, The best recommendation is to actually take them together. They have a much stronger pain relieving effect if you take them together. So you take like 2 extra strength Tylenol and 2 Advil or Relieve, whatever works best for you. You take those together. Now, that is just from research that I read. I've also had suggested it to patients. I always say check with your doctor before you do that. As a chiropractor, I can't prescribe medication to you, so please know that. Right? But it has very strong pain relieving effects with no worries of you getting addicted to it. Okay, and sometimes it can make a really, really big difference. And I've seen a lot of people say it's really helped them a lot. So I want you to know that. So try that. I hope this brought some value to your life. If you're suffering with back pain or you have someone that you love that is, especially a mom somewhere between 35 and 55 years of age who just wants to be the mom that they want to be and they can't be it anymore and they're afraid that maybe surgery is their only option or they're going to have to live on pain medications or just keep getting injections or ablations or microdiscectomies, and you're looking for another option that's natural pain management and also to help your body heal from the inside out, and you're looking for a different solution besides an invasive solution, please make an appointment to talk so we can talk. Normally to set up a consultation with me, it's $197. Right now I'm doing it complimentary, so there's no excuse. You can go to bookings.drshawnmcwilliams.com and you can get on my schedule and let's sit down and talk. We can do a Zoom call. If you have any sort of images or an MRI, I want to see those because I want to give you a second opinion on those and make sure that you're getting the right information. And I want to shed a lot of light on your situation too and hopefully bring some hope. Perhaps see if Disc University, the course that we've created, is a great fit for you. It is for a lot of people, and if for some reason it's not, I'll let you know that, and I'm going to help you get to the right person as well. Okay, so Stephanie, you're so welcome. Great to have you here. So go to bookings.drshawnmcwilliams.com. There is a limitation on those slots, so go there. You'll get to learn a little bit more about what we do and see some amazing testimonials. And at the bottom, you can book an appointment with me to sit down and we can chat and let's see if we can get you feeling better quickly, okay? Without surgery and without drugs. So I appreciate you being here. Stephanie, always great to see you. I hope you're doing great today. And you are so welcome. Always my pleasure. So if nobody has any questions for me right now, I'll say goodbye. Please give yourself permission, moms, to be good to yourself and to rest and let your body heal. Nobody can do it for you. Your husband can't do it for you and your kids can't do it for you. Only you can heal yourself. And by doing that, we're going to help you do that and teach you exactly what you need to know step by step. But you got to give yourself permission to rest. Stop vacuuming, stop washing the dishes, stop doing the laundry, and ask for people's help to do those things. And you'd be surprised. A lot of times they want to really help you because they love you. Probably more than you think they do. So, and they want to help mom because mom's amazing and mom does so much for everybody in their family. So let them give you back the love that you deserve by giving yourself permission to rest and follow these steps, okay? Hey, can't wait to talk to you. So make sure you book a call with me before they're all filled up. All right. Marisa, you're so welcome. Hope you beautiful ladies have an absolutely incredible day. If you're in Georgia, go get outside for a little bit. It's gorgeous. It's going to be gorgeous. And go do something good for yourself today, okay? You deserve to be celebrated. And don't always wait for someone else to celebrate you. Go celebrate yourself today. You do a lot for a lot of people. And you need to be rewarded for just how amazing you are and nothing else. And Stephanie, you're amazing. Marisa, you're amazing. And everybody else that's on here that didn't say hi, you're amazing too. And I love and appreciate you. And I'll see you next Wednesday. Bye, you guys.